cataract, a lot of people think that's something that grows in the eye. It's really not. All a cataract is a cloudiness of the natural lens inside the eye. We all have that. I'm 43 years old now. My lenses aren't as clear as when I was 23. That's all there is to it. And just about everybody by the time they're 60 have some degree of cataract. And it just means the lens is cloudy. And when it gets to the point where it's starting to bother you, we call it a cataract and we remove it.
The eye has two lenses to it. The very front clear dome is called the cornea. And there's a little lens that's about the size and shape in real life of an M&M candy just behind the colored part of your eye. Over the years, it gets a little bit cloudy, sort of like we'll always develop a wrinkle at some point. We'll always develop a little cloudiness to our natural lens, and that's all a cataract is.
The most common sign is people come in and say, I need new glasses. I just can't see as well as I used to. Some people find they have difficulty seeing at night. They feel that they don't want to go out driving at night because oncoming headlights really bother them.
Raindrops, headlights just give you a little more of a wince, a little more glare than you used to have. Or when you're walking in and someone flicks on all those fluorescent lights, or you walk into the supermarket and you just don't feel you seem quite as clear or as clearly as you used to.
And a lot of people, it happens so gradually that they don't realize it. People come in and say, gee, you have a cataract. They're like, I do, I see fine. But when we check your vision, it's really not that good.
You really have to remove the lens, and traditionally it's been removed using ultrasound, but now we can do this with laser with much greater precision and better outcomes.
Actually, we've been fortunate enough to be the only practice in Western New York with two different laser options to do a blade-free, all-laser cataract surgery. So nowadays, the laser can focus inside the eye and with a couple of bubbles make all the incisions we used to do freehand. We'd like to think of ourselves as pretty skilled surgeons, but no human can make a perfect circle or a perfect square, which makes your healing more predictable, which makes your visual result more predictable, and ultimately makes your case that much safer.
We always try to expand our technological options, so you may be better for laser number 1 and someone else may be better for laser number 2. And so by having that choice, we can get better results for the patient.
Options are good. It means we have so many more things we can offer you. So these days, we have lots of ways to do the cataract. We can do it traditionally. We have these awesome lasers now to do cataract surgery. And then in addition to that, we have all these lenses. We have bifocal lenses, astigmatism lenses. We can do monovision, one for distance, one for near. It gets kind of complicated, but it really makes us do a surgery that's individualistic for the person. And it's just wonderful as a surgeon to have all these options.
So I'm a tour guide of Niagara Falls, and I drive a 24-passenger bus. And that's when I started to notice. It was this past summer, and I started to notice that there was something going on with my eyes, particularly at night. So I'd been told about a year ago that I was starting to develop cataracts.
Very nearsighted since I was a boy, and wore glasses since I was about age 9. And my adult life, I wore contact lenses probably for the last 20 years. And very, very nearsighted, could not function without the help of glasses. You know, I could see clearly about an inch away from my face, literally there. Would clear, everything else was gone. So that's where I was vision-wise.
I guess the biggest thing that I was noticing was that for several years, I couldn't seem to get a really crisp prescription and get my vision so that I was able to see things precisely and clearly. And I kept complaining that the prescription just didn't seem to be doing the trick.
I was getting hard at night to drive. There were the circles around the lights, and making turns, it was hard to see exactly where I was going. And in general, my vision was getting it seemed I needed much more light, and I was tired when I would read for any length of time.
I had the first surgery in September, and incredible, the difference. I didn't realize how bad my eyes really were, even after being corrected, how bad they really were, until I had my first lens replacement put in, and the vision difference is absolutely incredible. Absolutely incredible. It has literally changed my life. It's incredible.
I had the surgery. I can tell you that everyone there was marvelous. It was painless. I wasn't nervous. It went very easily, very well, and I'm so pleased.
It was remarkable I noticed almost instantaneously how much the vision in the one eye had improved, and it was such an easy procedure. I'll admit I was a little nervous, but there really wasn't anything to be nervous about. Everybody was so professional and so caring and so wonderful in terms of explaining everything and how everything was going.
I had the procedure. The procedure was so quick. I felt nothing. 10 minutes or so was over. I sat up on that table and I looked across and I saw Dr. Elmer and I said to him, "I can see you." I was just so, I'll just get teary-eyed thinking about it, because it was just spectacular to me that since I was 7 years old I couldn't see that I could see him. He had this big smile, and of course he loves his job because he makes people so happy.
When she came in the next day after we did her surgery, she was just in awe. It was one of those things you could just see the smile on her face from across the room. It was really neat. And after we'd done both eyes, she looked at me and she said, "You know, it's changed my whole personality, my whole psyche, because I just always known my person as somebody that's needed glasses. And so here I am, glasses free and independent." And she's actually just retired from her job. She's looking sort of to change her life, and it just was this big change for her. So it was really exciting.
I've gone from wearing contact lenses and glasses literally my whole life to having 20/15 vision now, and I don't need anything, you know.
Coming into the office and having all of these people be so warm and so friendly, when it's such a situation that can be anxiety provoking, you know, that somebody's going to do something to your eyes, they really help to walk you through that and to have you be comfortable with everything that's going to be happening.
If you're thinking about cataract surgery and it's time for them to be removed, I would say please do it. There's no pain involved. It's very easy. The office, the staff, everyone is just so kind. And the results are unbelievable. It really is a miracle.